Pritzker, the president of OSF Healthcare St. Anthony Medical Center, and it's my pleasure to welcome the governor, members of the Illinois General Assembly, many of our local community leaders, as well as our own mission partners to OSF St. Anthony here today. I want to offer my sincere appreciation to the governor, as well as members of the General Assembly, for their tireless work they have devoted to improving the healthcare delivery system for patients across the state of Illinois. OSF Healthcare is proud of the strong relationship we have developed with both the governor and General Assembly. This partnership began with the Pandemic Health Worker Program, a program that helped reduce health and mental health barriers for residents of Illinois during the COVID-19 pandemic. And that partnership continues on today with the Medicaid Transformation Project, which is bringing digital health care services to some of our most vulnerable populations. I also want to thank you, Governor, and members of the General Assembly for your willingness to tackle another challenge that many of our patients struggle with. That's the practice of health insurers delaying and denying coverage of needed medical procedures to control cost and limit exposure of insurance providers. Our patients have significant concerns about this practice, so we thank the General Assembly for making this a top priority. Thank you again for being at OSF St. Anthony today, for your unwavering commitment to our patients to make certain they have access to quality health care now and in the future. At this time, I welcome Governor Pritzker.
Thank you very much, Paula, and good morning, everybody. It's always great to be here in Rockford. I really do. I think of this as a second home, maybe a third home, because I live in Chicago, at least did before I became governor. Obviously, Springfield, where the governor's mansion is, and then there's Rockford, which I always love coming to, and everybody's so welcoming. So great to see all of you. We're here today at OSF St. Anthony Medical Center, which is one of the great institutions, healthcare institutions in our state. We're here to highlight the Healthcare Protection Act, a bill that, if passed, will help us curb predatory insurance practices and empower patients and their doctors. I'm joined today by a terrific crew of people, and if I miss anybody, you'll correct me, but Lieutenant Governor Juliana Stratton, who I have the pleasure of working with every day, and she is a true leader for our state. Rockford Mayor Tom McNamara, who I've worked a lot with over the years to try to bring projects and support for the city of Rockford. Senator Robert Peters, who's the chief sponsor of the Healthcare Protection Act in the Senate. Senator Steve Stottleman, Representative Dave Vella, both of whom, again, you guys send leaders to to Springfield on your behalf, and they fight for Rockford and the surrounding communities like nobody else. And I just want you to know it's few communities that really know that they've got people that are every day promoting their home communities in Springfield and making sure the governor knows what you need. So I'm always grateful to them. And then, of course, OSF's Chief Medical Officer, Dr. Lisa Davis. Last week, the Illinois House passed the Healthcare Protection Act, whose purpose is to make quality care easier to access for patients across the state of Illinois and to increase accountability by insurance companies. For far too long, insurance companies, not doctors, have been free to determine what treatment options patients should have and how quickly they can receive it. With this bill, we're putting power back in the hands of doctors and patients. The HPA starts out with a focus on utilization management. Too many patients get hit with an unexpected roadblock when they're forced to wait a long time for permission from their insurance provider before they can receive care, all while dreading the possibility that their request will be denied. Too often, utilization management results in a denial of coverage because insurance companies simply want to boost profits. It's an unhealthy and an unfair system for patients. Utilization management comes in many forms, but it's seen most prominently in prior authorization and step therapy. Prior authorization forces consumers to get approval from their insurance company before beginning treatment, even after their doctor has deemed the treatment medically necessary. And with step therapy, insurance companies can require patients to try and fail on often less effective treatment options and medications first before getting the actual care recommended by their doctor. Well, there's no question that medical professionals are better suited to make recommendations about treatment than insurance company employees and bureaucrats. So with this bill, we're requiring insurance companies to use the same treatment criteria to determine medical necessity that doctors do. That way patients get what they need. And we're banning step therapy in Illinois for fully insured and Medicaid plans. The Healthcare Protection Act will also make Illinois the first state to ban prior authorization when it comes to inpatient hospital setting mental health care, because those who are in crisis should never be forced to navigate difficult insurance policies, especially in those moments of crisis. When shopping for health care coverage, it's important that insurance companies be transparent about prior authorization so consumers can make informed decisions when purchasing coverage. That's why the HPA requires that insurance companies publicly post every treatment that requires prior authorization. We're protecting consumers further by prohibiting insurance companies from selling what are called junk insurance plans, which don't even meet the minimum standards of the Affordable Care Act. By doing so, we're joining a growing number of states, 12 so far, and it's time for Illinois to join those 12. The second focus of the Healthcare Protection Act is on improving network adequacy. We're setting a standard for care availability. We often see problems with in-network directories and their listed availability. When a patient goes looking for a provider, that list may show doctors and specialists who no longer even accept new patients or aren't any longer in the network, or sometimes don't even exist. These ghost networks make it even harder for patients to locate care nearby without waiting weeks or months for an appointment. To combat this problem, our bill requires that insurance companies regularly update their provider directories to show the true availability of healthcare providers. And finally, with this bill, we're continuing our efforts to prevent insurance companies from gouging their customers by unfairly hiking up their rates. Last year, my partners in the General Assembly and I ended these unfair rate increases for individual policyholders and for the small group insurance market. The HPA would require the same for large group insurance carriers now. The Healthcare Protection Act is a set of consumer-focused health insurance reforms that will return a sense of autonomy and control to patients and their doctors. We're protecting Illinois families, making it easier and less labyrinthian to navigate the world of healthcare and insurance. I also want to shout out to my partners today in this fight. This bill has two outstanding chief sponsors, Senator Robert Peters and Representative Anna Muller. They're both working incredibly hard to advocate for Illinois families, and I'm grateful for their leadership. When I delivered my budget address back in February, I told you that I'd put my shoulder to the wheel to get this done, and I meant it. That's why I'm here traveling to communities across the state to tell Illinoisans about this legislation. Yesterday, I was in Belleville, and I was in Peoria. Robert was with me, and we were there to make sure that we're talking to doctors and patients and consumers with one message. This bill will save lives, and it will lower healthcare costs for millions of Illinoisans. Together, we will get this bill through the Senate. put a lot of pressure on my friend, the senator who's led this effort, but I know it's very popular, and we had bipartisan support for it in the House of Representatives, so I expect we'll be able to get this done, and then we'll land it on my desk where I'll proudly sign it, because the people of Illinois deserve reliable and safe access to quality care. So with that, I'm proud to introduce one of the hardest working members of the General Assembly, and again, the chief sponsor of the Healthcare Protection Act, Senator Robert Peters. Senator.
No pressure, no pressure. It's going to be easy going. I'm State Senator Robert Peters of the 13th District, which is located in from downtown along the south side of Chicago to the Indiana border. And I just want to say, first off, amazing work by sponsor Rep. Moeller and to members of the House for getting this done, particularly the advocates as well, for pushing and making this happen. This is a bipartisan bill that has come out of the House chamber. And we are one step closer to bringing comfort and dignity to healthcare patients all over the state. I'm no stranger to our healthcare system. I was born hard of hearing. I've had multiple surgeries throughout my life. I struggled with mental health issues. I've seen these struggles with my friends and family. And in my 20s, I lost one parent to cancer and another to alcohol abuse due to her coping with her own mental health trauma. Like so many constituents, I know the anxiety and fear that comes with navigating our healthcare system, especially right now as my wife and I are looking to have children in the near future and are doing fertility treatments. It is hard enough trying to navigate the day in and day out of life, whether that is taking care of friends and family and taking care of work and home chores. It is understandable that a bunch of healthcare papers and policies can add even more anxiety to your life. I have a unique district. I talked about it earlier. It stretches from downtown. So if you've ever been to Chicago Navy Pier, through the south side to the Indiana border, the old steel mills and steelworks site. It's home to large health systems, a public health system, safety net hospital. It is also home to people who live across spectrums, particularly across race, class, and gender. But the one thing that is nearly universal is people who have felt pain when it comes to their health insurance. What we are doing here is fighting for the everyday Illinoisan who wants to make sure their loved one or even themselves is receiving the best care possible. That when your doctor recommends a treatment, that is the treatment that you get. That when your child is facing a mental health crisis, they get a hospital bed that is filled with love, safety, and comfort. That finding a provider or a plan isn't a guessing game for your well-being and your wallet, and that you aren't fooled by predatory companies masquerading their financial scams as insurance plans. This is a bipartisan bill coming to the Senate. And I know that big-time insurance companies are going to do all they can to fight back against this. They're going to throw every scare tactic, the kitchen sink. But we have made it clear, the door is open and that advocates, as well as opposition, are able to give input on this historic bipartisan bill. We're going to bring the people of Illinois with us to the negotiating table. We will get this done. We will continue to make Illinois a healthier and safer place. And I'll end on this. I want to thank the governor. I'm honored to be able to sponsor this bill, but I know I'm not alone on this. So many leaders and colleagues have worked tirelessly and personally to change and improve healthcare outcomes in the state. When we get this done, it was all of us committed to our constituents and ensuring that they have the best care possible. Next up, I want to bring up a true champion for the Rockford area. You might know who he is. I heard his face used to be on TV here. Senator Steve Stottlemyre. Thank you.
Well, good morning. Glad to see all of you. Happy we're to give you a few minutes off of work today, right? So glad to see you. You know, this legislation puts the power back where it belongs. It prioritizes patients. It guarantees access to health care without unnecessary barriers. But they haven't been the only ones who have been complaining. I just met this morning with a group of doctors. And for years now, they've been expressing concerns about how pre-authorizations have impacted and stressed them out. Following up with insurance companies and having to fill out all that paperwork is not a productive way for you and them to spend your time. That also means less time with patients as well. Banning step therapy, ensuring provider networks are accurate, and banning junk insurance, all efforts to protect consumers. So thank you to the governor and lieutenant governors for spearheading this plan. I, along with Senator Peters, who will do a great job in the Senate of sponsoring this legislation, look forward to passing legislation in the Senate in the weeks ahead. It's time control over health care is given back to patients and their doctors. I'd now like to introduce my colleague in the House, Representative Dave Vella.
Thank you, Senator Stadelman. Thank you, Governor, Lieutenant Governor, Senator Peters. And also, I want to say a special thank you to State Representative Moeller, who couldn't be here today. This is a great bill. There are sometimes things come across my desk, and I can't figure out whether I'm in favor of it or against it. This one, I'm 100% in favor of it. What this bill does is it's leveling the playing field between insurance companies and those who need care. That's the most important thing. And that's the thing that I heard at the doors and talking to people and talking to doctors day to day. This plan will speed up much-needed care, give decision-making power back to the patients, keep costs down, and protect the most vulnerable from being preyed upon by sham insurance companies. Under this initiative, the insurance companies can no longer tell doctors how to treat their patients, which is the #1 thing that I hear from doctors left and right. We're being told what to do by the insurance companies who have never been to medical school. Those patients can't be required to ask permission of insurance companies before getting treatment, which is another thing that I hear from patients all the time. I have to jump through hoops just to get the treatment that I need. And they can't be required to do cheaper therapy, step therapy, first, which only prolongs their pain and suffering with no real benefit whatsoever. These will all lead to faster and more effective treatments for the people of Illinois. And there are other provisions in this bill to protect our neighbors from sham insurance plans that charge people for giving no real coverage and having a few, if any, doctors in network. On a personal note, the last time the governor was here was about a month and a half ago to talk about child care, which he is a champion of also. At that, I was basically doubled over in pain. I had a real bad back. I was able to, luckily, come here, get my back surgery done at OSF, and the doctor was great, the nurses were great, the care was great. I just want to say thank you to all you for that. But it took me about a month and a half to get here because I had to go through pre-authorization. I had to go through physical therapy. I could barely walk, but I had to do physical therapy. I had to do all this stuff just so my insurance company would pay for the needed care that I had, and I was in pain the whole time. And I can tell you, weeks of waiting, and the governor will, I'm sure, will agree with me, weeks of waiting in pain is weeks that I'm away from work, that I'm not in a good way with my family. It's hard for me to do what I need to do. And I'm luckily, I've lived a good life, and I've had a lot of luck. There's a lot of people who don't have the same luck that I do. And if they're dealing with being in pain and having to go to their job as a waitress or go to their job as a nurse or whatever, and they have to wait in pain, it's tough. So I just want to say thank you to the governor, thank you to Senator Peters and Lieutenant Governor and State Representative Moeller. This is something that is much needed. Obviously, our healthcare system has a lot of fixes we need, but this is a big one. So thank you very much. And with that, I will bring up Dr. Lisa Davis to talk. Thank you.
Oh, we are now afternoon, so good afternoon. I am very honored to be able to speak today regarding this issue that my physicians here at St. Anthony and across the ministry of OSF are living every day. What we have in common is that all of us who are providers, our physicians, chose to go to medical school, and when we made that decision, a large driver of that was we wanted to help and to be good and be the best for the patients that we would care for. What we didn't realize was that, we needed a crash course, super advanced, in how you deal with insurance companies, how you deal with the red tape that you would experience. And so I know my colleagues here will say that they spend a large portion of their days not doing that direct hands-on patient care that they need to do, but fielding the landmines that they encounter with trying to do what's best for our patients. OSF is big on compassionate care, and that is what we want to do. And when we experience those barriers, those roadblocks that we often are faced with, that does not bode well for us as providers. It can be disheartening. So the Healthcare Protection Act is a step so far into the right direction, and it's exciting for us to know that the governor, that the legislature is in support of doing what's best for our patients, for the physicians, and bringing it back home so that we can handhold and do what we train to do and not get caught up in a lot of the red tape. What we see on a day-to-day is that oftentimes patients even need not just the mental health care, but also secondary care that should be done outside the hospital. And there's red tape regarding that. And, oh, you need a prior authorization. We get the prior authorization, something comes up, and now, oh, it's expired. Now you have to wait and do it again. And the whole time the patient's sitting here but not getting the true care that they need. And so this act pushes us far into the right direction, and I'm excited for that. And thank you for this opportunity to speak on it. My job next is to introduce our Lieutenant Governor.
Thank you so much. Hello, everyone. I am Lieutenant Governor Juliana Stratton, she, her pronouns. Thank you for joining us today. Senator Stottleman, Representative Vella, Mayor McNamara, it's so great to be back here in Rockford, and thank you to everyone from OSF for the warm welcome and that compassionate care that you provide. I'd like to start by thanking Governor Pritzker for continuing to prove that strong leadership doesn't have to sacrifice compassion. And I also want to thank Senator Peters and, in her absence, Representative Anna Moeller for leading the charge to advance this bill through the General Assembly. Though America is struggling with division, we are united on at least one thing: a collective fear about the skyrocketing cost of health care. In 2022, a little more than 65% of Americans reported having private health insurance. But having insurance doesn't guarantee that coverage will, in fact, cover you when you need it the most. Due to loopholes, sneaky coding, and sometimes just plain bad acting, it's hard to find many people who feel confident that their insurance provider has their best interest at heart. The work we are uplifting today marks the beginning of a new narrative in Illinois. The Healthcare Protection Act interrupts the status quo of predatory practices and instead returns power to patients and their doctors. This is not just a matter of access, though. It's also a matter of equity. A 2022 study of cancer patients found that Black patients were 3 times more likely to have been denied health insurance because of their diagnosis than white patients. We cannot allow a system to function in a way that deliberately leaves people out. And I'm grateful for the dedicated health professionals, many of you are in this room today, for standing with us in this fight. Every single person deserves access to care without adding stress about whether or not a faceless analyst at an insurance company will deem their doctor's prescribed treatment necessary. Let it be known that Illinois doesn't give up. We hear our people's pain, and we see the gaps that allow that pain to exist, and we will do everything in our power to deliver relief. We are quite literally laying down the law with private providers, and I am beyond proud to be a part of an administration that values humanity and health over profit. Thank you again for being here, and with that, I'm going to bring the governor back up to answer questions from the media. Governor?
Happy to take any questions from members of the media.
Is there concern this will drive up insurance costs?
The belief is that we're going to be cutting some of the red tape that takes months sometimes to deal with prior authorizations. Unfortunately, that's not just time that the doctors are spending, but it's also time that insurance companies are spending. So being able to cut some of that time, making sure that people are getting the treatments that they need, so that they're not having a prolonged issue like we talked about with Representative Vella, where you're waiting, getting other kinds of treatments than the one that actually will help cure the problem that you've got. That will help us cut costs in the long run.
When you say cut costs, are you talking about cutting overall healthcare costs or cutting insurance?
As you can imagine, it costs when someone goes over and over again, for example, to physical therapy, when the reality is they need surgery. And so you've got all that physical therapy, for example, just to use this example, but and could go on for months, and then the surgery finally. So someone's got to pay for your insurance, in fact, is paying for the physical therapy, and then they've got to pay for the surgery. So it'll cut costs overall. Hopefully what it'll end up doing, and of course we're also going to be regulating price gouging by insurance companies. Overall, it will cut costs for consumers especially.
How challenging has it been to just even get this onto the table finally? I'm sure this has been, at least in the back of a lot of people's minds for years.
For years. I think that's the good way to say it. You know, sometimes you step forward with something that's, you know, very popular now, and people think it's an overnight success. Actually, it took 15 years for us all to get here and there's a common understanding that these really are reforms that we need. And, I think that's one of the reasons that this kind of sailed through in a bipartisan way in the House of Representatives, and I think it'll do very well in the Senate as well.
Do you have a timeline for when it's going to be brought forward to us?
Maybe I should ask Senator Peters.
I mean, right now it's currently an assignment. This is something, I sort of joke and I say we needed it yesterday. So my hope is that we can actually get moving on this quickly. But the main thing and all that matters is whatever we have to do to make sure we get across the finish line. So.
Looks like a lot of insurance companies are going to fight this. It sounds great, but do you have the votes in the Senate?
Great question. I will say that just to give some indication, maybe I should start by saying we sat down with the insurance companies and listened to them before this bill was even put together. Obviously, there are pieces of this that they don't like. There are some pieces of it that they understood and were willing to work with us. And, by the way, fixes that we made in the bill before it was introduced based on things that they information they provided us, knowing that it was something that was actually would make the process of getting to yes faster and better, more efficient. So having said that, I'm certain that there are folks who are lobbying hard against this bill, but in the House of Representatives, 81 votes, that's a pretty big majority. 60 is a majority in the House of Representatives. And having 10 members of the Republican Party vote in favor of this, and I should point out the only doctor in the House of Representatives also voted in favor of this, and enthusiastically, and has talked to some of his colleagues about it. One of the leaders of the Republicans in the House as well. So I'm optimistic about what will happen in the Senate, but you don't want to count chickens before they're hatched, so to speak. I think we'll do very well in the Senate, especially under the leadership of Senator Peters.
What was that, if you worked with the insurance companies before bringing the bill, what was the sticking point that they disagreed with that you came to?
It's more in the details of how do you implement some of the things that we want to make sure happen here. So rather than try to dive into each of the weeds here, I'd rather just point out that, look, a lot of times this happens with the big bill, and you know who the folks are on the other side. You want to sit down and listen to them. Maybe they're not going to support the bill in the end, but maybe they would. And then, meanwhile, you might learn a few things from your opponents that will make the bill better. And in this case, I think that, that happened in a few specific areas, and so I'm somewhat confident. I don't want to be overconfident about it, but again, these are things. Whenever we talk about these provisions to just regular folks, Representative Vella talked about knocking the doors and talking to people at their door. I mean, people talk about this before there was ever a bill. The problems of trying to get through the bureaucracy of an insurance company to finally just get what your doctor said you needed. And so I think that there's a reason why this, I think, will come through in a bipartisan fashion on the Republican side too. Yeah. Thank you.